during these unprecedented times.
We want you to know that we are committed to ensuring
that your child's education continues
and that you are not alone.
We are doing everything that we can
to make sure
no child
is left behind.
But to do so,
we need your help to get connected
and stay connected
with you and your child.
So reach out to us, speak to us about how we can best support you
and your needs.
Working hand in hand with you
is the only way
to secure our children's future.
We are in this together.
We are in this together. Sincerely, your school leaders.
Dear students, we know that you miss your friends, being outside,
and most of all, coming to school.
And we hope you understand that everything happening right now is to keep you safe
from harm.
You are our priority.
You are the future.
Even though these are tough times,
we believe in you.
We believe in you.
To be the leaders we know you can be.
To stay focused on doing your best work,
even when no one is watching.
To be helpful and respectful
to your parents and guardians at all times.
To be kind and thoughtful
to everyone around you.
Always be thankful,
even for the little things.
And most of all, to remember
to keep in touch with us because
we're here for you.
We are here for you.
We are here for you. Love your teachers.
The RCIPS is all about saving lives, and primarily the road policing department focuses mainly on road users who so choose to endanger their life or the lives of other road users. Most recently, of concern, there has been an increase of road violation, and as such, the police are out in their numbers conducting various checkpoints. Last week, we have recorded over 166 road-related incidences where individuals were cited for excessive speeding. The faster you go, there are three main consequences that will occur. One, you increase the likelihood of being involved in an accident. You increase the likelihood of endangering or seriously injuring yourselves or other road users. And three, it is highly likely that you will be intercepted and prosecuted by the police. As the law stipulates, for every mile that you exceed the speed limit, there's a $20 fine. If you're caught doing more than double the speed limit, a citation will not be issued, but you'll be warned for intended prosecution. A summons will be developed and you will be placed before the court where the matter will be adjudicated, and if found guilty, then you will inevitably lose your license for 6 months to a year. The RCIP acknowledged the challenging time most families are experiencing as a result of the COVID situation. However, what we will not do is compromise safety for speed. Therefore, we're encouraging motorists to comply with the road regulations, show due care for other road users, and slow down on the roadway.
Adjusting to this new norm can be difficult, where social distancing has become key, especially in our community, where getting together is how we show love for friends and family. The virus uses us to transport it around our community. Imagine you are asymptomatic and didn't know. Imagine you gave the virus to your friend who lives with their elderly grandmother. Imagine your friend had it and wasn't aware. What if they infected your brother or sister who has an underlying health condition? This is how the virus spreads. But we can stop the spread by continuing to social distance, limiting public gatherings, and not visiting other households. We can save lives. Remember, social distancing is Cayman kind. For more tips and advice, please visit www.gov.ky/coronavirus.
parents and guardians.
We care deeply about our students.
And we understand the challenges you may face
during these unprecedented times.
We want you to know that we are committed to ensuring
that your child's education continues
and that you are not alone.
We are doing everything that we can to make sure
No child
is left behind.
But to do so,
we need your help to get connected
and stay connected
with you and your child.
So reach out to us, speak to us about how we can best support you
and your needs.
Working hand in hand with you
is the only way
to secure our children's future.
We are in this together.
We are in this together. Sincerely, your school leaders.
Dear students, we know that you miss your friends, being outside,
and most of all, coming to school.
And we hope you understand that everything happening right now is to keep you safe
from harm.
You are our priority. You are the future.
Even though these are tough times,
we believe in you.
We believe in you.
To be the leaders we know you can be.
To stay focused on doing your best work,
even when no one is watching.
To be helpful and respectful.
To your parents and guardians at all times.
To be kind and thoughtful
to everyone around you.
Always be thankful.
Even for the little things.
And most of all, to remember
to keep in touch with us because
we're here for you. We are here for you.
We are here for you.
Love your teachers.
The RCIPS is all about saving lives, and primarily the road policing department focuses mainly on road users who so choose to endanger their life or the lives of other road users. Most recently, of concern, there has been an increase of road violation, and as such, the police are out in their numbers conducting various checkpoints. Last week, we have recorded over 166 road-related incidences where individuals were cited for excessive speeding. The faster you go, there are three main consequences that will occur. One, you increase the likelihood of being involved in an accident. You increase the likelihood of endangering or seriously injuring yourselves or other road users. And three, it is highly likely that you will be intercepted and prosecuted by the police. As the law stipulates, for every mile that you exceed the speed limit, there's a $20 fine. If you're caught doing more than double the speed limit, a citation will not be issued, but you'll be warned for intended prosecution. A summons will be developed and you will be placed before the court, where the matter will be adjudicated. And if found guilty, then you will inevitably lose your license for 6 months to a year. The RCIP acknowledged the challenging time most families are experiencing as a result of the COVID situation. However, what we will not do is compromise safety for speed. Therefore, we're encouraging motorists to comply with the road regulations, show due care for other road users, and slow down on the roadway.
Adjusting to this new norm can be difficult, where social distancing has become key, especially in our community, where getting together is how we show love for friends and family. The virus uses us to transport it around our community. Imagine you are asymptomatic and didn't know. Imagine you gave the virus to your friend who lives with their elderly grandmother. Imagine your friend had it and wasn't aware. What if they infected your brother or sister who has an underlying health condition? This is how the virus spreads. But we can stop the spread by continuing to social distance, limiting public gatherings, and not visiting other households. We can save lives. Remember, social distancing is Cayman kind. For more tips and advice, please visit www.gov.ky/coronavirus.
parents and guardians.
We care deeply about our students.
And we understand the challenges you may face
during these unprecedented times.
We want you to know that we are committed to ensuring
that your child's education continues
and that you are not alone.
We are doing everything that we can to make sure
No child
no child is left behind.
But to do so,
We need your help to get connected
And stay connected
with you and your child.
So reach out to us, speak to us about how we can best support you
and your needs.
Working hand in hand with you
is the only way
to secure our children's future.
We are in this
You're in this.
together.
We are in this together. Sincerely, your school leaders.
Dear students, we know that you miss your friends, being outside,
and most of all, coming to school.
And we hope you understand that everything happening right now is to keep you safe
from harm.
you are our priority. You are the future.
Even though these are tough times,
We believe in you
we believe in you.
to be the leaders we know you can be.
to stay focused on doing your best work.
Even when no one is watching.
To be helpful and respectful.
To your parents and guardians at all times.
To be kind and thoughtful.
To everyone around you.
Always be thankful.
Even for the little things.
and most of all, to remember
To keep in touch with us because
We're here for you. We are here for you.
we are here for you.
love your teachers.
The RCIPS is all about saving lives. Primarily the Road Policing Department focuses mainly on road users who so choose to endanger their life or the lives of other road users. Most recently, of concern, there has been an increase of road violation, and as such, the police are out in their numbers conducting various checkpoints. Last week, we have recorded over 166 road-related incidences where individuals were cited for excessive speeding. The faster you go, there are three main consequences that will occur. One, you increase the likelihood of being involved in an accident. You increase the likelihood of endangering or seriously injuring yourselves or other road users. And three, it is highly likely that you will be intercepted and prosecuted by the police. As the law stipulates, for every mile that you exceed the speed limit, there's a $20 fine. If you're caught doing more than double the speed limit, a citation will not be issued, but you'll be warned for intended prosecution. A summons will be developed and you will be placed before the court, where the matter will be adjudicated, and if found guilty, then you will inevitably lose your license for 6 months to a year. The RCIP acknowledged the challenging time most families are experiencing as a result of the COVID situation. However, what we will not do is compromise safety for speed. Therefore, we're encouraging motorists to comply with the road regulations, show due care for other road users, and slow down on the roadway.
Adjusting to this new norm can be difficult, where social distancing has become key, especially in our community, where getting together is how we show love for friends and family. The virus uses us to transport it around our community. Imagine you are asymptomatic and didn't know. Imagine you gave the virus to your friend who lives with their elderly grandmother. Imagine your friend had it and wasn't aware. What if they infected your brother or sister who has an underlying health condition? This is how the virus spreads. But we can stop the spread by continuing to social distance, limiting public gatherings, and not visiting other households. We can save lives. Remember, social distancing is came in kind. For more tips and advice, please visit www.gov.ky/coronavirus.
afternoon and welcome to today's press briefing on the coronavirus. I'm Donna Bush. Glad you could join us on our various channels as well as Radio Cayman. We go first to today's prayer from Reverend John Case.
Shall we pray? Our Heavenly Father, we come to you during this time when it seems our world is turned completely upside down. And yet right in the middle of it all, we can see the hand of God caring for us. A God that's saying, fear not, I am with thee. Do not be dismayed, for I am thy God, and I will give thee aid. We thank you for all the times in the past when you have helped us, times in the past when you've kept your hands upon these islands. We thank you so much for the times that you saved us from the storms or in the midst of the storms, different situations that have come to these islands. You've been there. You've helped us, and we thank you for it. And even in this pandemic, we can't help but see the hand of God that's been so good to us. We would pray, Lord, that you would continue to provide the wisdom and strength to all of those who are involved in making choices. And Lord, we would pray especially for the Premier, for the Honorable Alden McLaughlin. We would pray for our Governor, Mr. Martin Roper. We would pray for the entire cabinet and ask you, Lord, to guide them and direct them. And Lord, may they seek you for the wisdom that comes from God. We would ask you that you'd help the Cayman Islands people, Lord, to do their very best to obey the laws of the land and to have patience in the midst of this trial that's come upon them. We're glad we're serving an awesome God who's able to do exceeding and abundantly above all we can ask or think. And Lord, we would say with the songwriter, our faith has found a resting place, not in device nor creed. We trust the ever-living one. His wounds for me shall plead. Lord, you're enough, and we're trusting you. Meet every need, and for what you do for us, we'll praise you. In Jesus' precious name we pray, and for his sake. Amen.
And thank you, Reverend Case. We now welcome our panelists, His Excellency the Governor, the Honourable Premier, as well as the Honourable Minister of Health. Joining us in studio, we have the Chief Medical Officer, as well as the Acting Deputy Director of HMCI, Teresita Da Silva, and our sign language interpreter. Joining us on Zoom are members of the media, as well as the Medical Officer of Health, Dr. Samuel Williams Rodriguez. We go first to Dr. Lee.
Good afternoon. People attending the Health Services Authority should have been given a leaflet about how to get their results when they've had a screening test for COVID-19. What they're hoping is that everybody who has an email address will log in through the patient portal. However, I do know from information received today that only 35% of people have activated their account in order to log into the patient portal. If you already have a valid login, of course, you don't need to do this. You can just log in and get your sample. But if you're having difficulty logging in, please do contact info@hsa.ky, info@hsa.ky, and somebody will contact you and help you through the login process if you're trying to get hold of your result. If you don't have an email address, because I recognize that, of course, some people don't have that, the HSA should be calling you with your result. Everybody that's positive at any of the hospitals will be contacted by public health within a very short time of that result being available to public health. We recognize that because we're doing an awful lot of screening at the moment, there is a backlog of results because we are trying to make sure there's always a lot of work to be pushed through the laboratory so that the laboratory is always working at top capacity, and that's been successful. So successful, in fact, that since last Sunday, the HSA laboratories have resulted a total of 1,935 tests, which for a population the size of Cayman is really an incredible number. And I really appreciate their really sterling efforts towards helping us getting these results out. Some of you who like figures may have noticed that, as the Governor has reported, we have been pushed into the top 10 of the number of results we're able to produce, test results we're able to produce per million of population on many of the world sites that collect this data around COVID-19. I wanted to let you know the results. Obviously, you're all waiting for those. We have a total of 8 positives today on a background of 467 additional test results. So of the 467, 8 were positive. One of these is a contact of a known case, and the other 7 we are assuming is community acquired, is that there's no travel-related history to those other 7 people. That brings our totals to 129 people who have returned positive results in Cayman, and there are 67 of those currently active cases, of whom 12 are symptomatic, 55 are asymptomatic. There remains no one admitted with COVID-19 disease, and there are 61 recovered. Of the positives, you'll recall that 3 have occurred in Cayman Brac, and 2 of those relatively recently. I'm pleased to report that all of the contact tracing for those Cayman Brac people who were positive has not revealed any positive results, so that's good news for the Brac. I think that's all, Donna. Thank you very much.
Okay, thank you very much, Dr. Lee. We're going to go first to Ralph Lewis from Caymanian Times. Ralph, please go ahead.
Good afternoon, Dr. Lee, and thanks for your report. Can you please give some clarity on contact in the word contact tracing? Is it those people that are living in the same household, or what would you say for someone who is working with someone who has lived with someone in the household that has tested positive? There's some clarity on contact in the word contact tracing.
Contact is defined by the World Health Organization. So we're following that definition for this particular disease, which is that any household, anybody that's living in the same household is a close contact automatically. However, outside of the household, it's anybody who's been within 3 feet of somebody, a meter of somebody for a sustained period of time, which is 15 minutes. It's not a hard and fast rule. So because you'll understand that this is guidance, so the contact tracers will often discuss with people the nature of the contact just so they can be sure they understand. Because clearly, if you come up and give somebody a big hug and a kiss, and then you find out later they're positive, even though that contact may have been very brief, that clearly is a bigger risk than if you stood 2 feet, 2-3 feet away from somebody having a conversation for 5 minutes. It's a starting point, and then the contact tracers will have a further discussion. But those 2 issues, less than a meter for 15 minutes, and and somebody living in the same household, are how we use this as a starting point for contact definition.
Okay, thank you. Just had some concerns because as we open up and people will start moving around, of course, co-workers will come into contact with co-workers whose wives or partners may test positive. And these are the concerns that we may have at some point.
Yes, so that would be a contact of a contact. So we would not normally contact trace in that case, no.
Okay, thank you. That's it, Donna.
Okay, thank you, Ralph. We go now to Reshma from the Cayman Compass.
Thank you, Donna. Good afternoon, Dr. Lee.
Good afternoon.
Can you say if any of these positive cases are frontline workers?
Yes, they are all frontline workers.
Okay. In terms of the construction industry and the testing of those employees, can you give us any updates on that?
I mean, that's a very active thing. Of the people that I've provided for you today, in fact, none of those are from the construction industry. So, but the construction industry, we're really pushing that forward. From I know that we have taken samples in around 1,600 construction workers. It's a question of getting those results back. So that's, as I mentioned earlier that's part of the backlog. I know that we have resulted around 1/3 of those already, and the lab is going to be producing more results today, tomorrow, and so on for the construction workers. But we're having a good number of results, and I'm hoping there won't be any delays in opening up construction as the government has planned. Everything seems to be on track in that regard. We're not finding any pockets that are giving us any cause for concern.
Okay, great. Thank you. Now, we've seen a vast majority of the cases here in the Cayman Islands being asymptomatic. What can you attribute to that? Is it indicative of anything localized to Cayman?
It's tricky. I'm not sure that answer is really going to come out until the dust has settled, so to speak. I know that's not helpful. Everybody wants to understand that point. It's a very interesting point. I have a strong suspicion it's weather related. I've said so on numerous occasions, and that it doesn't really like the warm weather. I think that it seems that once something gets a hold, especially if the density of the population is very, there are a lot of people in close proximity, like we've seen in other countries, in prisons or in nursing homes, that there's a particular danger points, especially as certainly in the nursing home you have a more debilitated or an older population who may be more susceptible. I think what's also interesting is of the results that we keep reporting, around a half of them are coming in as a week, which means that our period of isolation of lockdown that we've had, sorry, I should say lockdown, the period of lockdown that we've had has actually allowed a lot of the disease, which I believe is still here and has been here all the while, to burnt it out relatively, which is why people are at the very end of expressing any virus, which we're just picking up and it's just showing as a weak test result. Not everyone is weak, but quite a few are weak, which would suggest that's where we are, and we've done the right thing to try and stop the spread of it.
Okay, thank you for that. We've seen businesses, a particular business advertising temperature scanners for sale on island. Now, some of the larger countries, for example, Hong Kong, is using scanners to in their COVID-19 fight as well. How useful are these, and is it something that businesses should consider installing?
I currently would not recommend it. The reason being, from the evidence that I present to you every day, the number of people who don't have any symptoms. So therefore, it may well generate a false sense of security. Throughout this disease, some countries in the world have been saying, don't bother temperature screening, because we know that a number of people are presenting with either without a significant fever, they've only got very mild symptoms, or they've got no symptoms at all. So although it can sometimes be used as a tool as a cross spectrum, and it could be used as one check as well as, and many companies will be interesting, a daily check to take your temperature. It's one of a series of things as well as your symptoms as well. There are some diseases like MERS and SARS where almost everybody generated a temperature. So there are some diseases in which it is a lot more valuable. So if, for example, we were going to put in temperature monitoring at the airport, I wouldn't be at all resistant, because it'll have use in the future, certainly, even if I think that the relative use of it at the moment is limited. I'm sorry for the long answer, but that's my feeling on the matter.
That's okay. No, not at all. No need to apologize. It helps bring clarity to the issue. My final question for you today. Now, last week, Friday, you talked about the antibody testing and possibility of the introduction locally. How far has that process gone?
I know they've been ordered. I haven't heard that they've arrived, but we'll of course share that information. I'm really excited to have that available on the island.
Okay, great. Thank you very much, Dr. Lee.
Thank you.
Thank you, Reshma. We now go to Felicia from Radio Cayman.
Hi, good afternoon, Dr. Lee.
Good afternoon.
I just have a couple of questions for you. Are there any updates on the IgG testing, and are there any plans to roll that out?
So the IgG testing has been ordered. It's not yet arrived on island. And we will be advising when it comes and how we'll be using the testing.
Okay. And do we have any idea on how immunity works? Is it possible to contract the virus twice?
I think you are asking about immunity in relation to COVID-19.
Yes.
So in line with many coronaviruses, humans usually do develop a degree of immunity, but that immunity doesn't necessarily last for that long. We haven't had enough time to describe carefully the immunity profile that humans would develop following having had the disease, and certainly there's no vaccine, so we can't talk about immunity related to a vaccine. We will get that information with time, but we need time because we haven't had enough years to pass to know how long the immunity might last if you have had an infection. Whether you can get it twice, it is probably likely that you will be able to get it twice because immunity for many viruses often does not last that long, so that you'll be able to get something again if you've had it before. However, I couldn't give you an absolutely certain answer on that point, and we will learn more as time goes on.
Okay. Also, do you have any thoughts or theories on why so many cases on island appear to be asymptomatic?
I think some of the listeners would have heard me answer that a little bit earlier today, this afternoon.
Okay. All right. Thank you. That's all my questions.
Thank you.
Dr. Lee, I have two quick questions, and thank you, Felicia. The first one is companies that are out there that may want to register their employees to be tested. Is that something that can be done? And what's the process?
Yeah, we're not currently opening it up like that. We're not currently inviting people to come forward. We really are trying to focus on the areas which we're opening up in order to inform the decisions. And it's actually unhelpful if people try and come forward because it floods the system, whether it be with queries or with people pitching up and saying, can I please have a test? So we're trying to keep our focus on the construction industry at the minute. And as time goes along, we'll advise how that will change because undoubtedly it will change with time.
Okay. The other question is the flu hotline. Once a person's called the flu hotline, typically they're told to self-isolate, particularly if they have any signs or symptoms that they may have COVID. Is that still the process, or are these persons now being called in to be tested?
No, absolutely, it's still the process. The actual details, I'm not sure if Dr. Williams is on the line to answer the details of what would happen.
Sure.
But isolation is the first step because that protects the community in general. It's likely that you're going to get a test thereafter, but I would defer to Dr. Williams about the practicalities of it.
Okay, thank you, Dr. Lee. Dr. Williams, are you able to assist any further in answering the question?
Yes, good afternoon. So basically, yes, isolation would be the first step, and then testing at the end of isolation. The rest of the person will be tested as needed.
Okay. Thank you very, very much, Dr. Williams Rodriguez, as well as Dr. Lee. We're going to go now to our Honorable Premier.
Thank you, Donna. Hello, everyone. Happy Friday. I just want, before I have a number of announcements to make, information to share. But before that, I just wanted to offer some observations on where we are as a country going through this process. The messages I get range as we have these press conferences, and like this week we've announced a significant number of positives. The messages range from, I'll then lock it back down again, lock us back down again, to to people and businesses who say, when can I open my business? So just let me say this. We do not believe, and I think Dr. Lee has on the line, that there's any cause for alarm at all with the results that we are getting in terms of the numbers of positives. We're still, I think, on average below 2% of those tested over time, testing positive for the virus, which is, quite frankly, incredibly low. There is no spike. There are no clusters being discovered. In fact, as has been said a number of times, not one person has turned up at a clinic or at any of the hospitals with COVID-19 symptoms since the 27th of April. And there are no sick people in the hospital that is sick with COVID-19. So we are in an incredibly good place there. We are actually hunting down the virus now. The people that are being tested, that are testing positive are people who are being tested as part of a screening process. So we would expect that doing it this way, we will wind up with a significant number of positives because we've always known, well, known is too strong a word, believed that the virus must be out there all of the indicators would tell us that that's the case. And looking at around the world at how this thing works, there must be, we said, significant numbers of people out there with the virus. What we are seeking to do is to avoid what has happened and is happening in many places in the world. A lot of places are, I believe, operating with a false sense of security because they aren't seeing the cases being presented. They are concluding, some of our neighbors too, that the virus is not there. But the only how you can be certain of that is we're doing what we're doing, which is testing. And even that is not foolproof. It takes a while, even the population as small as it came on, if we were to test everyone, that would still take a significant period of time. And in the meantime, persons that tested negative 2 weeks ago, even a day ago, could now be testing positive because they've contracted it from somebody else. So it's not foolproof. But the government strategy and plan is operating very much as we expected it to. And we are not seeking to test every single person. We are trying to test broad demographic of people, focusing at any given time at the area that we are unlocking or have recently unlocked, so that we can have a representative sample of that group of people and understand the prevalence of the virus within that particular demographic. And as Dr. Lee has said over and over again, we isolate you, we test you, we trace the contacts, we test those, and take whatever action that is deemed necessary following that. Nothing is ever going to be completely risk-free. We can't keep the economy locked down indefinitely. So we are doing everything we can to minimize the risk. And what is clear from the actions we've taken so far is that while there is, without question, widespread community transmission of the virus, we're seeing it across a whole range of demographics. It is not by any means rampant. The numbers are numbers are very, very small. And one of the incredible things about this, which I think the scientists will answer at some point, is that for one reason or some reasons which are not yet understood, the virus does not seem to be being transmitted readily at this stage in the Cayman experience, nor are people getting sick or really sick. In the early stages of this, the virus was very much presenting the way it has done right across the world. We had some very, very sick people in hospital at some points, some leaving aside the initial patient zero. We had some people who came close to death. That is not occurring now, praise be to God, for reasons I don't think anyone really fully understands. But we have to be very careful that we don't fall into the trap of not having had a first wave. Dr. Lee said we had a ripple, but that we don't become complacent and we do wind up with a wave. And that is why the government is still continuing with a great deal of caution, unlocking areas of the economy only after testing, extensive testing, and a great deal of thought about that before we move to the next stage, and waiting a minimum of 2 weeks to see what impact that unlocking has had on the results. So that's why we're going about it in this very careful and thoughtful way. So for those people who are impatient and want to get back into business, that's the reason we're going about it this way. I've said more than once that dead people generally don't make good customers, and sick people don't make good employees. So we are trying our very best to ensure that the Cayman experience is very different to that of the majority of countries that have had this experience. We're going to keep testing for the foreseeable future. Even when the economy is pretty much completely unlocked, we will continue the testing to ensure that the virus is not somehow starting to build a head of steam that we don't know about. And the only way we can know about it is if we continue doing representative sampling of the community. So I just wanted to say that to start. I want to address some questions that have arisen about the ability of certain businesses to open on Sunday. So the effect of lifting the hard curfew on Sunday is to allow businesses to operate as they normally would under their trade and business relevant trade and business licenses, subject only to the restrictions imposed by what we call the soft curfew, the shelter-in-place provisions. So on a Sunday, that would mean that mini-marts and gas stations, those two are ones that I think have been having their issues, are permitted to open because their licenses allow them to open normally. But here's the issue. While they're allowed to open because their licenses permit, the shelter-in-place provisions still only permit persons to leave their homes on a Sunday for two purposes: to go and collect food which you have ordered from the restaurant, or to go and exercise. So it doesn't permit you to go to the gas station to get gas, for instance, or to go to the mart to buy food. Uncooked food, I mean, groceries. So that is what I think has been causing the confusion over the course of the last weekend. So I hope that helps to clarify what the legal position is with that. The one thing I can say is, as I keep saying, have patience. If the numbers keep trending the way they are, a lot of these things will be able to fall away in another week or so. I shouldn't tempt fate or whatever it is out there, but that causes bad things to happen. But that's, things are actually trending quite well in terms of the numbers, despite the apparent increase in the numbers. It's because A, we're testing so many more people, and B, we're chasing down the virus, we're hunting the virus, we're trying to find it wherever it is. So don't be alarmed, my people, about that. So I have a couple of, more than a couple, a number of things to, not so much announce, but information to give. As questions keep turning up on various of the sites that we have, and we're trying to answer them, and so my very helpful staff put these things together for me to share. So the question is, what is the procedure for returning work permit holders? The travel helpline is transitioning from the governor's office to CBC, and the processes are being revised with respect to this. However, in the interim, the process for persons seeking to return to the Cayman Islands is as follows. They must register their intent to travel to the Cayman Islands by contacting Emergency Travel Desk via web, https://www.exploregov.ky/travel. Email address is emergencytravel@gov.ky or phone 1345-244-3333. Requests for permission for work permit holders and non-Caymanians to travel to the Cayman Islands are considered and decided on by the Deputy Premier's office. Approvals are subject to a number of considerations. Confirmation that the employee works for a company that has resumed business and that the physical presence of the employee is essential and required. 2, checks will need to be done to ensure that the employee's permit is active, has sufficient time left, and that the employer is in good standing with business licenses, relevant health insurance premiums, etc. Confirmation there is adequate capacity at the government-run isolation facilities to house the employee on arrival, and the availability of flights. If the employee is deemed eligible to return, the employer must confirm that they will be responsible for the cost of the isolation stay and will pay it up front, that they will also be responsible for the cost of additional isolation if the employee tests positive at the end of the 14 days. Confirmation that the employee also has secured private accommodation and the ability to pay for that accommodation after isolation is necessary to avoid reliance on the government. As a side note, with the passage of the Immigration Transition Law amendments in April, new work permit applications and work permit renewals are subject to advertisements on the Jobs Cayman website. This will help to ensure Caymanians registered with work are aware of jobs that are available. Caymanian job seekers have an opportunity to apply and have the first preference for jobs. This will also better assist the decision makers to be aware that Caymanians applied for jobs. And we keep getting asked, understandably, about international mail. A little progress. Our postal service has successfully tested outgoing mail to the US, and it is working properly. So at this time, outgoing international mail is limited to the US, letters, parcels, registered, and EMS. Customers should not expect usual delivery times. The U.S. Postal Service is also challenged with reduced staff and social distancing protocols. On 1st of May, our Postal Service advised our international partners how they could resume service to Cayman. However, it is the sending country's responsibility to get the mail here. We have regular contact with our key postal partners, namely the U.S., Canada, and the U.K., as to incoming transportation options. The Cayman Islands Postal Service will continue to work with other countries to establish transportation links so international mail service can be resumed, and will advise the public as increased service becomes available. And then a bit of good news regarding Water Authority rates. The Water Authority regulations allow for an annual rate adjustment. However, this year, there will not be an increase in water and sewerage rates. This means that the Water Authority customers can continue to access water and wastewater services, services that are vital for public health at an affordable rate. Customers can find the Authority's current rate structure for potable water and sewerage services by visiting the Authority's website, which is www.waterauthority.ky. Additionally, the Authority has waived penalty fees for May this year. This is the third time the Authority has done this, having waived penalty fees for March and April as well. The Authority has also developed a COVID-19 payment deferral policy to assist persons who may be temporarily out of a job due to the pandemic. If a customer has been impacted, please contact the Water Authority about the deferral policy via email info@waterauthority.ky. And finally, I want to give a shout out to the government communications team, who have been doing a sterling job keeping everyone informed. They have worked many long and hard hours. It is through their efforts that government has better been able to raise the public's awareness of the steps we have taken and that are on their way to help us control COVID-19 and stay safe. I have been impressed at the accuracy and timeliness of the information provided to the public and the way the team has engaged with the public with a variety of forms of communication that speaks to everyone, from the elderly to the teen. The communication has been clear, simple, and easily understood. And for that, I think we should all be grateful. And as Premier, I can say I am very proud.
Thank you, Premier McLaughlin. Your Excellency.
Yes, okay. Thank you very much, and good afternoon, everybody. I mean, as the Premier has said, let me just also say that I am not greatly alarmed by the sort of the positive cases that we're getting at the moment, and we're getting a very large number of negative results. But as we hunt down this virus and do a huge amount of screening, we would expect to see results like this. But I do think it's significant, as Dr. Lee said, that a lot of the positive results we're getting now are very weak results as well. So I won't say much on this today, just to say that I also believe that our strategy is on track. We're doing the right thing in a careful, measured and prudent way. We will be able to open up more, but we just ask everyone to remain on their guard, keep going with the social distancing, the basic hygiene, wearing of masks in public places, because the virus is out there and we just don't want to take any risks and undo all the good that we have so far done. Let me just turn to evacuation flights. So the BA air bridge for tomorrow, going back to London and then straight on to Manila. That will take out about 280 Filipino nationals going back to the Philippines. And huge thanks to everyone who's been involved in that, because it's been a significant undertaking. I also want to note, as you will have seen, that Cayman Airways have added 2 flights to Miami on the 5th and the 19th of June. These are outbound only, and we're not bringing anyone back as the isolation facilities remain at capacity. So you can book those flights in the normal way through Cayman Airways. I've also been asked by the Cayman Airways, the Cayman Islands London office, just to make a short announcement about any future BA airbridge flights from London to Cayman. And we are certainly planning another one in June, but no dates yet for that. And the Cayman Islands Government Office would like you to register with them for that flight if you're coming from London to Cayman, and not with the travel helpline tool. So if you want to come from London to Cayman on those flights, contact the Cayman Islands Government Office directly. And the telephone number is +44 207 491 7772. Or you can email them at info@cigouk.ky. For all other destinations, including those wishing to travel from Cayman to the US and Canada, they should continue to register via the online tool, and the Premier has given those details just earlier. I've also been asked to point out that there is now a central contact point for inter-island travel, and you're asked to email bractravel@gov.ky to receive more information on travel and register your details with them for requests for inter-island travel. And please note again that travel to the Sister Islands is restricted to essential and medical returns only. So yesterday I visited the Emergency Field Hospital, which has been a collaborative effort between the National Emergency Operations Centre, HSA, members of our Defence Regiment and Public Works. My particular thanks to Pastor Alston and the congregation at the Family Life Centre, Chambers Gibbs, McAlpine, Simon Griffiths, Dave Shelton and Graham Jackson. They've all done a fantastic job with this, and it's a hugely collaborative team effort. Of course, we hope very much we never need this field hospital, but taking such proactive steps will ensure that we're ready, and it's also very useful for the future if we have any other emergencies. I just want to make a brief comment about the prison. Everybody knows that we had a couple of positive tests at the prison this week, and there was understandably a bit of tension around that. But I do want to urge everyone to be responsible on social media. And I do condemn in the strongest terms the social media rumours about rioting in the prison, because that was completely untrue. And I think people who are putting rumours like that around need to think about the impact on the families of our prison officers and the families of prisoners, and what impact you're having on them. It would have been very easy to have checked the facts before those rumours were circulated. And one of the hallmarks of good journalism is to check facts. So I would really ask people to think very carefully about this in the future. Let me also just give a brief shout out to Danny Coleman, Director of Hazard Management, who actually isn't here today, but Teresita, it equally applies to you as well, and the entire team at Hazard Management for this tremendous performance in organising and executing the annual Hurricane Tabletop exercise on Wednesday. to carry out this exercise in the current crisis situation of a pandemic was bound to be a challenge, but I understand that it went extremely well and a lot of useful lessons were learned. So a big thank you to everybody who was involved in that. It really is important we keep those things going. And then finally from me, I want to give a shout out to Florrie, if I can find the right piece of, here we go, Mrs. Florrie Holder Ebanks, who was 103 years old yesterday, lives in the West Bank, and I want to send birthday greetings to you, Mrs. Ebanks. I know that you were very active in tourism and your two sons were very active in football. And one of your sons, Ray, was a national coach. But I know the Premier and everybody will join me in wishing you a very happy 103-year-old birthday. Thank you.
Thank you, Your Excellency. Minister of Health.
Thank you very much, Donna. Good afternoon, everyone. Grand Cayman, Cayman Brack, and Little Cayman, and our Caymanian diaspora listening in. I pray we pause and appreciate that direction is more important than speed, and don't be busy looking at your speedometer and forget the milestones we have made in hindsight. But I'm guessing some would want direction to be different. Let's look at hindsight again, as it is easy to know the right thing to do after something has happened, but it's harder to predict the future. Well, should have Russia do their act of kindness in context. Russia, as a humanitarian act in April 2020, just last month, Russia sent the USA a bunch of medical supplies, including ventilators, when the USA was seeing almost 900 deaths per day. Russia at the time stated their coronavirus cases were very low, and they were proud of their strict measures they took in good time, as quoted. This month, or 1 month later, the USA is sending 200 ventilators to Russia because their coronavirus has peaked so high. What really happened in Russia? They are now seeing the second highest rate of confirmed cases after the USA. I believe this should send a reminder that although I am a proponent in helping our country relax the restrictions, and I know firsthand of the detriment to businesses in general, but we still need to be mindful, as the African proverb says, only a fool tests the water with both feet. And again, some are saying to rush and open everything one time, but who knows if that's right or not. Wouldn't it be wise to take everything step by step, as we have an elephant of a task right in front of us? And the old proverb says we should never attempt to eat an elephant whole, but cut it up into pieces and eat it bit by bit. Taking a godly approach to everything is what helps me and many who call, write, and pray for me. I have humbled myself as a minister of government to consciously bring devotion at a time when most of this country yearn for some comfort. I say most, and I've never expected that my blessing to come from earth, but as the Father above. A sinner I am, yes, and far from perfect. Scripture reading today is from Luke 6:35-37. But love your enemies, do good to them, and lend to them without expecting to get anything back. Then your reward will be great, and you will be children of the Most High, because he is kind to the ungrateful and wicked. Be merciful as your Father is merciful. Do not judge, and you will not be judged. Do not condemn, and you will not be condemned. Forgive, and you will be forgiven. May the Lord add a blessing to the reading of his holy word. Shout outs. I want to shout out the litter crews I saw them working in Savannah and in Bordentown this week. Keep doing the amazing job. I see the bags of garbage bag ties on the side of the road to be picked up. And it's glad that you guys are able to get back out there. Thank you for doing a wonderful job. I want to say happy birthday to Joseph Minzit and also to Miss Jean Ramon. Jean Ramon will be celebrating her 80th birthday. Happy birthday, Miss Jean and Joseph. I also want to thank the student from Prospect Primary who sent a video, actually. You sent a video to me thanking all of the panel. Thank the governor, thank the premier, thank the commissioner, thank Dr. Lee, all of the panel and GIS. And he also said that he was, the Bible verses were uplifting. Thank you, Leighton Eden. We thank you very much for doing that video. It's much appreciated. I want to thank all those companies and persons who continuously reach out in all kinds of ways to MLAs and community leaders to assist those who are unemployed or temporarily out of a job with most of their needs. We couldn't do what we are doing as effectively without you. I thank you. I want to also thank the William Quintet for sending me that uplifting song. I actually love that song. Thank you, Lord, for your blessings on me. This COVID-19 is inconvenient, really, really inconvenient in every way you can think of. And we get it. Families need to be fed, and they want to do it themselves. But it was impossible to predict how badly we'd be affected or infected, whatever adjective you prefer. But this is probably the first time the reason for an economic crisis is not an economical one. And it's all from this coronavirus. I also wanted to note that, and I think Dr. Lee can confirm this, it is not necessary for persons who are driving in the car by themselves or persons who are running and walking. I actually had a friend told me that they were running with their mask on last week and they felt a little faint. And I said, you know, it's not necessary to wear masks at this time, whether you're running or driving in the car by yourself, you know. So please take that note, because we don't need any accidents. In the last few days, we've seen an increase in the number of positive cases, COVID-19, as our healthcare teams are working diligently on testing and contact tracing. Many are asymptomatic cases. It is because of instances like this the government is continuing to be pragmatic about how we open the Cayman Islands back up for business. Safety precautions are important. Testing is important. And while we wait for the testing to continue on a wider scale, we encourage you to wear a mask when in public. Wearing a mask has been proven to slow the spread of coronavirus and can help in ensuring the health and wellness of every resident in the Cayman Islands. But I emphasize that in addition to wearing masks, we must continue to practice good hygiene and washing your hands, practice proper respiratory etiquette, and follow the social distance requirements. In the meantime, you can find information online on why we should wear masks and how to make a homemade mask at www.gov.ky/coronavirus. Simple, key in the words mask in the search bar. On another note, I also want to bring to your attention that this week is celebrated globally as EMS Week, recognizing emergency medical services personnel or emergency medical technicians and paramedics. In life-threatening emergencies, we all depend on the bravery, skill, and professionalism that these men and women who work in our emergency services, medical services exhibit, while in close collaboration with partners at 911 and the fire service and police. Since the beginning of COVID-19 pandemic, we have been especially grateful for the EMS personnel across our islands who define what it means to be frontline of our response. Emergency medical technicians and paramedics have stepped up to the challenge, often putting their own lives at risk to help preserve the health of others. These courageous men and women are trained to provide vital medical services in a broad range of settings, and they do this every day in our neighborhoods, in our homes, and on our streets. The work you do frontline every day to respond to emergencies is truly commendable, and I thank each and every one of you. Today, I'd also like to advise the public on our testing kits and what's been going on since the 200,000 we had purchased. We have a total of 1,390 test kits remaining. That equates to 139,000 tests that can be done, as each test kit contains 100 tests. Just to be clear, 1,390 test kit, but each test kit can do 100 tests. So we have 139 tests that can be done still by this PCR. Based on the breakdown of the kits sold to other countries and those used by the HSA, we sold 12,000 or 120 to Bermuda. We sold 200 to Barbados, or 20,000. We sold 10,000 to Bahamas. This was sold on the 4th of May. And we donated in exchange for 5,000 to St. Lucia. And approximate use by the HSA to date is 14,000 or 140. So that's it, 1,390 test kits remaining. It has been a blessing to be able to take care of our own country as well as to help our regional neighbors in this way during this time. In closing, I have some additional shout outs to Dr. Diane Hislop and her family for recently donating a significant amount of PPE supplies to Faith Hospital in Cayman Brac. Also, a big thank you to the Light World Church for donating meals to the nurses on Nurses Day last week. Last but not least, to the Royal Bank of Canada for donating lunch to the HSA staff this past Sunday. Until next time, please stay home. Remember to practice social distancing when in public, wash your hands, and take care of each other. Check on a friend. I thank you, and God bless.
Thank you very much, Minister of Health. We're going to go straight into...
Don, if you don't mind, I just want to send happy birthday wishes to two individuals. One, the minister mentioned, who is a dear friend of all of ours, Miss Jean Ramon, who's 80, and to a young lady, the other end of the spectrum, who's 9 today, whose name is Sajne. Happy birthday.
Happy birthday to everyone. Okay, so we're going to go straight into questions. I think I'll begin today with the questions. The first one is, although it may seem frivolous to some people, there are people who are looking forward to having some type of a summer vacation, not off island, of course. And they're asking questions like, when do we think we'll be able to accommodate staycations in Airbnbs or local condos, that sort of stuff?
Okay, let me walk way out on the limb here. But if current trends continue, 4 to 6 weeks.
Okay.
Unless Dr. Lee tells me no.
Dr. Lee.
And that's often.
Another question from the public. If someone's business totally shut down back in March, as many businesses did, are they expected, once they open back up, let's say in another few weeks, are they expected to be up to date on things like pension and health and their trade and business licensing? Bearing in mind, again, that they've been totally shut down since March.
But we've started the pension. You don't have to make any pension contributions for 6 months. So that one's sorted. Health insurance is critical because people get sick in good times and in bad, and we're actually in a public health emergency. So you would be expected to have your health insurance. I am not, and I ought to be better up to speed on this one, but I can't remember whether we have taken a decision about deferring trade and business licenses fees, but I think we have.
I believe till June or July.
But forgive me, as I say, I ought to know that, but I'm drawing a blank. I can't remember.
There's something that we did, but
Yeah.
so much that we did.
I know. You can't possibly remember everything, but hopefully that was helpful to the person who asked that question. Okay, we're going to go now to Reshma from the Cayman Compass. Reshma, are you ready for us?
Yes, I am, Donna. Thank you. My first question goes to the Premier. It's from the public. A number of people have messaged us asking, and you've shared some good news on the Water Authority. Is there any word from banks on extending mortgage payment deferrals? Is that something that's in the making?
No, individuals will need to contact their bank. I think most banks offered a 3-month holiday, if we call it that, on payments. But beyond that, each individual will need to contact their respective bank and work out arrangements.
Okay, great. Thank you for that. Now, as you know, the public continues to send in questions in relation to the beach. And one nagging question, I can say, is the rules as it applies to people with different names living in the same house. Now, the regulations say you have to go under your surname alphabet rules, but also under exercise, you're allowed to exercise with people from the same household. How do you, what can you tell the public to really clarify who's allowed to go to the beach and what's okay? And I think they like to hear from you rather than us telling them.
I don't think the issue is one of clarity. I keep getting it over and over again. People think that there should be some provision that allows people in the same household to go to the beach together, but it's completely unenforceable. There is no way the police can be asked to investigate who's living with you and who is not. So I could just ask people to be patient and to remember that this time last week, you couldn't go to the beach at all.
Okay. All right, thank you. Now, just on the point of borders, I know you talked about it already this week, and we are looking at September or possibly beyond September, but some of the Caribbean islands have already announced that they are looking at opening June, July, in particular St. Lucia, Antigua, and Aruba. Now, what do you have to say about their opening, and do you think that this will leave Cayman disadvantaged when we have to open up our local economy for tourism?
Well, each country will have to make their own decisions based on their own particular circumstances and their assessment of the risk and the situation at the time. But I don't believe that many tourists are going to want to come to a place which is rampant with COVID-19 and where hordes of people are sick and dying. And that's what opening our borders at this time is likely to bring us.
Okay, fair enough. Now, as we contemplate reopening our borders, some of the countries that are going that route are talking about putting in specific guidelines. Dr. Lee talked about the temperatures, possible installation at the airport. Have you worked out, or has government worked out what that protocol or what that system is going to look like for us when it comes to that point of reopening to outside visitors?
I think you may have gotten the wrong end of what Dr. Lee said. He expressly said that taking temperatures is no guarantee of anything, and he thinks it's rather pointless because you just take the Cayman scenario where the vast majority of people who are now testing positive are completely asymptomatic, i.e., they don't have things like fevers. So Dr. Lee also referred to the ordering of the antibody tests. So all of these are part and parcel of various measures that various countries are looking at. But the reality is that at this point, there is nothing out there that is sufficiently reliable to be able to say that you can allow someone into your country without any real risk. The best test that there is the one that we're using. I can't say that word, the Polymerase something or other. The PCR test. I've tried 6 times to say that word, I can't say it. The PCR test is the most reliable, and that's what we're using, but that is not instant, it's not overnight. So for the foreseeable future, anyone who comes here, whether they are Caymanian or have permanent residence or on a work permit or they own a place here, because we're having now a number of applications being made by people who have winter homes here or summer homes here, whatever, who live here on a part-time basis who want to come back. But for the moment, for the foreseeable future, everybody will have to be quarantined for a minimum of 14 days because we cannot risk introducing what may well be a much more virulent strain of the virus into Cayman. That would be absolutely disastrous.
Donna, could I just add to that? Just on testing, I think it is just worth highlighting that the UK does have one of the best sort of science and research bases in the world. And I know there are 2 trials underway now in the UK of rapid tests, but they are weeks, possibly months away. So we're watching all these developments very closely. But as the Premier said, we don't have anything at the moment that is reliable, but there could be something in the future. And I think the UK, it's worth saying on a vaccine, the AstraZeneca and Oxford University do seem to be really in the lead and in the driving seat in developing a vaccine. So I think, again, that's quite important for us here to be aware of that. As I've got the microphone, can I just apologise? I think when I was talking about Mrs. Florrie Holder Ebanks, I somehow said West Bank. Of course, I meant West Bay, and I live in West Bay, so I don't know how I got that wrong. I know we've had issues with people getting things wrong previously, so I don't think it was in the same range as a previous one. But my apologies.
Okay, thank you very much for that. You're excellent.
I'll never get forgiven for mine.
Reshma, please continue.
Okay, thank you, Donna, and thank you, Premier, for that guidance. Governor, since you were already on the mic, my next question goes to you. Now, we've seen that you posted this week that you met with the head of the UK Security Advisory Team. Can you tell us a little about that meeting that you had, the discussions, and also can you give us any updates on the regiment recruitment and the Cayman officers who will be going off to Sandhurst?
Yeah, sure, Reshma. I mean, Reshma, that was just an update on the work that they've been doing, and he's come out of quarantine, so it was a chance for me to meet him face-to-face for the first time. And as I've said before, they've been supporting us on procurement of medical supplies. They've been working with us to help on the Defence Regiment. They've been working with RFA Argus, the Royal Navy ship, and I mentioned previously that they've helped us secure helicopter cover for when our helicopters are off island. So they continue to be busy and continue to be supportive. On the regiment, our 5 junior officers depart tomorrow on the BA flight to Sandhurst, which is wonderful for them, a fantastic opportunity. So we are wanting to move ahead, subject to obviously COVID-19 risks, with recruiting the first sort of 50 people for the regiment, as I think I indicated at a previous press conference. So we're making as rapid a progress as we can on all of that ahead of hurricane season.
Okay, thank you. Now, you said he came out of isolation. Is it just him that is out of isolation from the team, or is the entire team now cleared from isolation?
I think, as I've said before, the two of them are out of isolation, but as out of abundance of caution, because there was one of those results that Dr. Lee mentioned, a very weakly positive COVID-19 result. So out of abundance of caution, we have asked the remaining members of the team to remain in isolation, and that will finish middle of next week. So within a few days now, they will all be out.
Okay, great, thank you. I'm not sure if Ms. Coleman is there. I had a couple questions related to the government facilities.
She's not here today, and her stand-in has left for another meeting. Sorry about that, Reshma.
Okay, maybe I can pose it and probably the governor can assist if he can. It's in relation to if there are any discussions going on with other local hotels to accommodate those coming back for quarantine?
I mean, the simple answer to that is yes, there are, and good progress is being made, and I'm sure we will make an announcement as soon as we're ready to do so. But yes, good discussions and progress there.
All right, great. Thank you. That's it from me.
Thanks, Reshma. We go now to Ralph from the Caymanian Times. Ralph, please go ahead.
And good afternoon, gentlemen, the panel. I have some questions for the Minister and for the Premier. I'll go first to the Minister. Mr. Seymour, thank you for your, all your praise and your positive support. Early in the days of the, of these press briefings, I asked a question regarding the wearing of masks, particularly in the buses. And from then, you were very supportive of wearing masks. Now we've seen where it is highly recommended that everyone should be wearing masks, and there are actually activities going on where masks are distributed across the island, and some by actually some representatives. We are seeing two types of masks being distributed. One is a cloth mask and one is the disposable mask. And my questions are, which one is better? Or are they all the same? And is those distributions coordinated coming from one government agency?
Well, from my memory, thank you for the question. Now I think it is mandated by most companies, supermarkets, and other businesses that you actually need to wear some kind of facial covering before entering their premises. The two different types of masks that are being handed out. The ones that I ordered were the surgical masks, which is the ones that were recommended by most in the medical field that we could hand out in the public, because the N95 masks, which are the better ones, which are 95%, block viruses 95%, are normally used for the medical staff, and we don't really want to, in a time when supplies are limited, we don't really want to tie up the supplies of what is necessary for the people that will save our lives, and they in needing their N95 masks. So we thought it was best to get the surgical mask, which protects or blocks out the virus 80%, as I understand it. With the cloth mask, it's good. It protects. It protects. You protect other persons from the virus. But as I understand it, and I stand to be corrected, that when it comes to blocking the virus, that it was 0% effective. So not to say that the cloth masks are not something that person should be wearing, a face covering, but possibly not for very long periods. But the surgical masks were the more effective in terms of blocking for virus. So it all depends on if you're just going to a supermarket and not in there very long, a face covering mask or bandana or whatever is fine. I think was mentioned. But for some reason, the New York ordered cloth masks, and I think where you're probably going is what you heard in the LA this week from one of the members talking about that the MLAs didn't get any of the cloth masks, and they only got the surgical masks, which I think people now are finding that some of the cloth masks are fancier and have different designs on them and look fashionable and everything else. And if we're going to be doing this for a while, they probably want one of them. However, some of the MLAs didn't have any cloth masks, and people were calling them, asking them for them. And I thought it was always best and more strategic that if you have 19 MLAs, which covers every inch of this Cayman Islands, that it would be best to always give MLAs at least some little stash so that they would have available for persons who come and call and ask. So that's the reason why we handle it in that manner. And we've handed out some 2,000 each to each MLA, whether you had a small constituency or not. I had the largest constituency, and I still had to painfully accept the 2,000. But definitely, we still want to encourage facial covering, whether it's a N95, whether it's surgical, whether it's just a cloth mask, we encourage you wearing some facial covering. I hope that kind of helps. I'm speaking from memory, so.
Yes, and I appreciate the timely response and taking time to explain it. And I'm sure we'll be seeing a lot of masks in the future because this epidemic is not here for tomorrow; it'll be here for a long time. Okay, can I just go now to the Premier Donna?
Yes, absolutely. Please go ahead.
Okay, good afternoon, Mr. Premier. Good to see you again. I really appreciate the positive and uplifting tone in your voice as you speak about the progress that we've made in moving towards the relaxing of the conditions. And I have a few questions. We have seen where it has been mentioned that if things goes as planned, that maybe by June 2nd we might see moving down to phase 2. Can you say some of the things that will be highlighted in phase 2? And maybe you could answer with these a couple. I'll just give an idea of what I would like to find out. Churches, watering holes, golf course, and maybe gyms.
I don't know. Dr. Lee's hiding from me behind the screen. I can't see him. I'm trying to judge his face, expressions on his face as you say those things. The next phase, not phase, the next level 2 suppression. We are still sort of designing what that would look like, but and again, it'll be guided by the results when we actually do that. But that would see, whenever it is, I'm not wanting you to hold me to the date that you just proposed, because I can't say that with certainty. But what that would look like, level 2, would be the reopening of the other retail establishments, which are currently now limited to delivery and curbside collection. So you'd see that. We'd also be able to see the reopening of outdoor restaurants and possibly bars. Again, we haven't sorted that aspect of, but certainly the restaurants. So they're sort of the principal ones. We would probably, at that stage, also be able to increase the number of persons allowed to gather from 2, because it's really, really tight now. I'm not sure we've settled on what those numbers would look like, because again, it's going to be guided by the results of this testing, which is showing widespread community transmission at this stage, although the numbers are small. Possibly golf courses, agreed. And I'm talking off the top of my head now. I don't have the plan in front of me, the sort of draft plan in front of me. But that sort of reopening and relaxation. There will still be at level 2 concerns about big gatherings of people and serious partying, because those are things that are known crucibles of transmission of the virus. The more people get together in close proximity for extended periods of time, the greater the chance of transmission of the virus. And so those are things that are still being talked about. But as I said, if the current trajectory continues, we will see some significant increased relaxation of the restrictions around business and social activity in level 2.
Thank you. And just 2 more brief ones. Just a question, and maybe you've answered this in the past, but permits, existing employment work permits, for those people who may have just got a work permit in March and had to stop working for the next 2 or 3 months for the 3-month permit, would that permit have to be renewed, or would it be extended, or would there be a refund if it was renewed?
I don't know the answer to all of those details, but what I can say from a broadly from a government policy position is that we would look sympathetically at those sorts of things. The last thing we want to do is to take money out of the hands of businesses. What we're trying to do with everything we do is to leave as much money as we can in the hands of businesses, so they can continue to hire people, so they can continue to operate. And so we certainly wouldn't want to penalize employers who have paid for work permits, which essentially haven't been utilized because of the circumstances.
And my final question before we plan for the weekend is, when can we expect to see the finance minister itching to ask about some numbers?
Right.
And you promised me about 2 weeks ago, and I'm going to hold to that promise, sir.
Right. So I'd hope to have that this week, but it was a short week because we had a public holiday on Monday, and we had the House on Wednesday. I expected it would go into Thursday, but thankfully that wasn't necessary. But we will definitely get it done next week. We'll have him on to talk not just about government finances, but also about the sort of the economic plan and thinking about how we survive without tourism for some months yet to come. I can say, and kind of going into that area already though, that we are hugely excited about the demand, the pent-up demand there is to get construction projects rolling again. And I think if we thought we had a construction boom before Corona, I think it's going to be even more so as we see construction continue to open back up over the next few weeks.
Thank you very much, and thanks for taking my questions. Donald, that's it all.
Okay, thank you very much, Ralph. We go now to Felicia from Radio Cayman.
Good afternoon. I just have one question for Premier Adam McLaughlin. A number of tour operators have expressed that they have received a one-time stipend, but just the one at the start of the pandemic on island and haven't received anything since. Do you have any updates that you can provide for them?
Well, there was only that one planned, but it is something that we are thinking about again, because no one knew how long this was going to drag on, and obviously this is going to be a long-term situation where they don't have very much to do in terms of business. So yes, we're having a look at that again.
Okay, thank you. My next question, I think, is better suited for the governor, Governor Martin Roper. Many are curious if there's any word on whether there will be flights to Jamaica soon, and if not, is there some kind of issue that may be preventing a flight to be arranged?
I mean, certainly we're very keen to arrange flights to Jamaica, but at the moment there isn't agreement from the Jamaican authorities to go ahead with that. I mean, that's the reality of the situation, but we continue to work behind the scenes to arrange that as soon as we can.
Okay, thank you very much. That's all my questions.
Okay, thank you very much, Felicia. We're going to go now to April from Radio Cayman.
Hi, everybody. My question is not directly related to COVID-19, but kind of indirectly. As we saw the hurricane discussions this week, the question of a lack of shelter capacity and how to manage shelter capacity with COVID-19 sort of social distancing requirements came up as part of the discussion. Do we have a way forward on any of that yet? Because it is a very real concern with hurricane season, around the corner here.
It is a real concern, April, and there were certainly some good discussions this week on that. And I know that next week there is a workshop or an online conference for all the overseas territories with Bournemouth University in the UK, who are sort of experts in disaster preparedness. And all these issues are going to be discussed to try and reach an agreement on what is the best policy for handling the hurricane situation in a pandemic. So just to really say that it's uppermost in our minds to find solutions to that, but we want to to do it in line with best practice internationally and benefit from others' expertise as well, rather than plough our own furrow at this point.
And I know that the Premier mentioned it already, but as a member of the media who has had very close contact with GIS and the information officers and CIGTV, we usually are criticizing everything everyone's doing, but I wanted to take the opportunity to really express a specific thanks to them for the support they've been giving the media throughout this entire time. It's a very difficult job that they're doing, kind of juggling between the demands internally and externally, and they've done a fantastic job. And so I figured I may as well steal the platform and say thank you very much, and in particular to Suzette Banks, who really has answered phone calls at 3 o'clock in the morning for those of us on deadline. So thank you very much.
Good to hear.
Yep, and I concur.
You too, Donna, you too.
Okay, I have some final questions really quickly. Persons are asking about expats who may want to leave the island, but moving companies are not able to go to their house, pack up their stuff, and ship off island. Any idea when that may start happening for those who want to leave but don't want to leave their belongings behind?
Yeah, I have to say that's not one of the areas that we have explored in our discussions. That now requires people to come into your house and so forth. So
yes,
we'll have to take some guidance on that from Dr. Lee and Public Health. Yeah.
Okay.
To see whether that's something that could be accommodated in perhaps the next opening, but I don't know the answer.
Okay. Someone also asked about helpers, but that again goes to the same.
I know about that one.
Coming to your house. Coming to your house. Another question. This one may be for Dr. Lee or Dr. Williams. How many antibody tests have we ordered? Do we have a number?
I'm sort of familiar with that. It's not a huge number because they don't last for very long. But what we've done is put in an initial order, and then we're going to have orders arriving over a number of months.
Okay, thank you very much.
We will have sufficient to test a large number of people on the island.
Okay. The next question is, someone is asking very specifically if they can go fishing in their motorized sailing vessel. Sounds like a trick question, but...
Well, I would think so.
So if they have a motorized kayak or a motorized sailing boat,
the commissioner isn't here, but I mean, if it were me, I would say okay.
Okay, and I think that's it for questions from me for today. Any final words from the panel?
Yeah, I just wanted to mention a couple final things. I forgot to mention that Minister Juliana O'Connor Connolly and Deputy Premier Moses Kekernel donated food to Faith Hospital yesterday. So I want to thank them for that. Also wanted to wish Tamara Ebanks from the CPI Ministry and happy birthday. And also Miss Lovie Britton. She's 82 years old. Happy birthday to you both. Also, finally, I just wanted to mention and something what the governor was saying in terms of the training for the regiment at Sandhurst. I wanted to mention, if people don't already know, that Sandhurst is has an illustrious history of over 200 years, and it has molded generals and captains and heads of states, and also it is a global center of excellence and for leadership. And I'm just happy that we got this opportunity. Thank you.
Thank you.
Yes.
Thank you. Premier McLaughlin, you have some final words?
Yes, I just a couple more birthday shout-outs. they keep coming in. Happy birthday to Mrs. Amy Hennings of the Creek, Cayman Brack, who is 91 today. And happy birthday to my good friend Deirdre. I'm not going to call her last name, and I'm not going to say how old she is. But happy birthday, Deirdre.
Okay, thank you. Thank you very much, Premier McLaughlin. And to everyone, of course, to you, the public, for joining us. We thank you, as well as to our panelists. We thank them for being here. And for those of you out there, a reminder to go online to gov. gov.ky/coronavirus. If you'd like to get some answers to some questions, we invite you to join us here again on Monday. Until then, have a safe weekend. And for those watching via TV, you can now take a look at the statistics for the regional and worldwide coronavirus cases.